While this pandemic is the center of attention now because of all the disruption it has brought in our daily lives, what happens to those who are suffering from chronic diseases like diabetes, cancer, or even kidney disease? How do we address the needs of patients with chronic conditions amidst a global pandemic? To discuss this, we have a very eminent panel with us. Please welcome Mr. Jortin George, Senior Vice President, Cipla. We also have with us Mr. Sandeep Bhatia, the Head India Business of Shilpa Medicare. We have Mr. Amitav Banerjee, the Director Sales and Marketing of Dr. Reddy's Laboratories, Mr. Prabhat Kumar Sinha, the Head Communications, Policy and Patient Advocacy at Novartis Oncology, and Mr. Poonam Parwani, Vice President, Koye Pharmaceuticals. A warm welcome to all of you for joining us on this session here. We are very grateful to have your perspective on the challenges that a lot of people are facing today, especially patients who have chronic conditions. Mr. George, I'd like to start with you. Now, what, according to you, was the biggest problem for patients of chronic diseases? And, even the pharma companies that supply these medicines to these patients during this pandemic time.
Thank you, Anisha. Thank you, IHW Council, for organizing this Gratitude Week. Before answering your question, I would also like to thank each and every healthcare provider, each and every service provider, each and every hospital, each and every public servant. They are endlessly fighting this battle. And it is incredible. And we really, on behalf of myself and my company, acknowledge it and thank you everyone for that. So looking at your question, the lockdown announcement was really a challenge for all of us because pharma company is concerned. Transportation is the key factor for our supply chain. So transportation is not there. It was a big challenge. Initially for us, if you look at, the cold chain medicines, which normally we air cargo from one city to other city. So once the flights are not there, it was an extremely difficult situation to reach these medicines. And also post-lockdown, people started having, stockpiling of chronic medicines. And that also created a little bit of panic buying, which created a short supply, especially hydroxychloroquine and other chronic medicines. But later on, I think it has improved. But I can give you an example. I have received a lot of calls from doctors as well as patients to our company. One example I remember is a doctor calling me from Vijayawada to our company and asking for a cancer medicine, and it was not available. And the team in Hyderabad has to arrange a special vehicle with the help of police and arranging this medicine. So these are all one of the few examples our supply chain team and teams in the field are helped out for the doctors to treat their patients.
Right. So, proactiveness was really welcome. The way the pharmaceutical companies reacted to requests from doctors was really noteworthy. Mr. Bhatia, I want to check from you. Did you also see supply side bottlenecks during this time? Because not just medicines, when the total lockdown was first announced at the end of March, people queued up to stock up on groceries on everyday needs, but they were convinced that, we're not going to get them after a few days. That never happened with groceries, and I don't think it ever happened with medicines also. You would walk into a chemist, you would get to medicines. So did you face a supply chain roadblock? Because there were also stories of how, trucks were being stopped at borders, even though essential services were allowed. There was so much confusion that they were being stopped at borders. What was your experience like when it comes to the supply chain?
Yeah, I think wonderful question. I think, Anisha, no doubt about it. I think the way kind of pandemic we are facing. So let me start by really thanking the medical staff, the paramedical staff, and all other associates who were part of this, and they have gone through this phase, rather they are going through this phase, and the kind of resilience they are showing, the kind of confidence they are showing, even if these people are suffering from a lot of mental and physical stress. But the way these people have gone about it, I think really they really need an acknowledgement. And on top of it, I would like to definitely acknowledge the ISW especially Mr. Kamal, Vivekanand, and the entire team, the way they have put up the efforts, the kind of annual, this month, weekly aspect which is going on, I think it is really wonderful. I must really say the effort which are put in by all of them is really great. Now, when it comes to basically the supply of medicine, and my example somehow really correlates with what George said, but I'll go two steps beyond. There were medicines which initially were in the stage when we saw the month of April, there was some panic buying. There's no doubt about it, especially the chronic medication. And there was no effect on the acute medicine. As you know, that in the industry, we definitely live on the acute and chronic kind of segment. So chronic medication, there was buying. People thought the lockdown will be there, the shops will be closed, there is going to be increased purchases. But we saw the easement coming up in the month of May, and June we saw normalization happening, especially in the chronic area, whether it is hepatology, whether it is oncology or diabetes or cardiac care. We actually, as a company, in fact, here I would like to quote even the Shilpa example as well, because currently we have medication in the oncology segment, and the kind of efforts which are put in, there's a very good supply chain in our industry, which has really helped. If you look at the chemists were open. They were also one of the warriors who have really phase 2, 3. In fact, the field staff of so many pharmaceutical companies, they went beyond their duties and they have been able to serve the patients. Not only that, we have got some of the associates, like this is a wholesaler association, there is a retail association, there are CNFs, and some companies have direct supplies. All these people really came forward and there was a tremendous unity. Therefore, in spite of the fact there were panic buying in most of the essential commodities, we never saw that in the pharmaceutical company. And I am 3 decades in this industry, but I can tell you, I think the efforts which were put in by this group of people was tremendous. Relentlessly, even I would go beyond one step, because the medicines has to get produced, because it is important that we produce the medicine and without any hiccups. So there were people who were there in the factory, there were people who were there in the R&D, there were people who were in the supply chain. Especially, I would like to acknowledge our supply chain system, where we have been really able to take the things forward. There were small wagons which were used. So I feel that the pass through of this phase has been pretty impressive from my point of view. And I don't see moving forward there will be any further issues when it comes to ensuring the supply of especially chronic medication, and things are definitely getting normalized quite a bit.
Right. Ms. Parwani, what according to you was the biggest problem that patients with chronic diseases faced during this pandemic, especially the earlier part of this pandemic? How did you handle it?
Yeah. With the advent of COVID-19 pandemic, patients with chronic diseases, I think, faced two-pronged challenge, Anisha. One was access to doctors. Mm-hmm. Second was access to medicines, primarily with transportation being in disarray. In order to address the situation of access to doctors for treatment, we at our organization facilitated doctors with telemedicine tool. The doctors started to adapt these and other telemedicine tools as well as to reach out to the patients. But the challenge for doctors as well as for the patients was in getting accustomed with telemedicine and video consultation. See, you see the chronic patient primarily is elderly. They probably are not very comfortable with computers or usage of smartphones. We as an organization operate in diabetes, gynecology, orthopedic segments. And we saw patients getting stressed out for access, especially so in diabetic management. We realized it very quickly, acted by launching patient support call center helpline numbers for diabetic management. This initiative not only helped patients get the stress relief, but also helped them get medications while they were sitting at homes.
Right. Mr. Sinha, Novartis does a lot of oncology products. What kind of challenges did you see? What kind of fears did your patients or users of your medicine voice? Because cancer is a critical condition, and you're susceptible with your immunity already low. So what were the challenges that your company faced to get through to your patients, to get the medicines across to them? Because there were a lot of protocols being laid down.
Thank you, Anisha. Before I talk on the issue, let me first take this opportunity because we are, celebrating a gratitude week, right? And first, I would like to pay gratitude to all these people who are living with this medical condition, chronic condition, what we call, whether it is cancer, diabetes, heart failure, thalassemia, sickle cell disease. I think while we are thanking everyone, the service provider, I think these people who are battling it day in, day out, living with the condition, their caregivers, the patient organizations who work with them, I think I would also like to pay a huge gratitude and appreciation to all of them because, they are surviving. And when we say surviving, there's a difference between surviving and living. They are avoiding death every day in a way. So I think they deserve a big round of applause from all the sections because they have been equally part of this journey. Now coming back to what you said is, I think what Jortin has said or what Mr. Bhatia has said is we all have overcome the issues of supply chain and all. But the biggest thing that these people who are living with these conditions were facing is isolation. The depression. The uncertainty. And I think as an organization, while all the pharmaceutical and healthcare companies started, battling, and a team I think had worked tirelessly with doctors, with chemists to overcome this. But one thing I think many of the companies, and Vivek is here online, is companies have also started reaching out to these patients and support beyond medicine. We often end up talking about drugs, but there is a lot goes beyond drug when we talk about chronic conditions. And I think I will talk about it going forward, but I think the focus has not only been on medication. Yes, that is critical, but there are a number of other things that goes beyond medicine for people who are living with chronic conditions.
Right. So I would like to introduce Mr. Vivek Srivastava, co-founder and CEO of Healthcare at Home, who's also with us. Vivek, like Mr. Sinha has pointed out, for all pharmaceutical companies, it is not just about getting the medicines across to the patients. The patients are anxious. At least at some level, I've seen the same insurance companies on their platform. They're giving an area for people to vent or to connect with medical professionals so that they get some advice or some clarity, and they're not as anxious as they are. Now, what was your experience during the initial bit of the lockdown for patients who had chronic conditions? Were they open to being treated at home instead of in a hospital setting? How did you overcome, if there were any such fears like that?
Thank you, Anisha. So I think, first of all, like everyone did, I would like to thank all the people who have been in forefront of delivering the delivering the care to COVID and actually non-COVID patients as well. No thanks would be sufficient enough for the sacrifices these people are doing. And these includes not only doctors, nurses, but the people who are going and delivering those drugs to the patient's home, because they're also taking that much risk
Yes.
in the process, right? And there are umpteen number of stories available with us, and I'm sure with everyone, where people have gone out of the way. Now, to answer your question on whether the patients are engaging. So as Prabhat mentioned, we have two businesses, right? One is directly working with the patients, where patients reach out to us and we deliver care to the patients. And the other business is where we work with almost all top pharma companies, 40 plus projects around chronic diseases along with pharma companies, right? So we have been in the thick of things from the lockdown period to the unlock period as well. Not only delivering product to about 650 locations in the country, but also delivering services. So if we think of the retail customers who we interact with directly, we at least made sure that whoever we were working with, we continued to deliver the services to them. So we didn't stop any day, any service to any patient, irrespective of whatever lockdowns would have been done, going out of the way, spending, money on cabs, etc., etc. And people were willing, actually people who used to get shifts of people in delivering care, they started, they actually accepted the fact that this is a change situation. So they let people stay in their homes so that travel is reduced. So people were very uh, you know appreciative of the situation and the hard work which people were doing, and hence collaborating and cooperating. Now on the services which we do with pharma companies, I think what we saw was a dramatic reduction in new prescription generation, right? So in almost all therapy areas where we work with, there has been a significant drop in the new prescription generation, whether it was through the lockdown period, where it was almost zero practically for almost all disease segments. And even in the unlock period also, there is, it's not that it has recovered back to the normal days. It's still very less as compared to what we were seeing in the pre-COVID days. That's a point of worry. While of course we are all trying to do something to reach out to the patients, we are also doing a lot of teleconsults and so on. But the patients who have not been in touch with any doctor, for them to be able to reach out to these doctors and get to a teleconsults have been tough. And especially when as you go away from the urban locality, which is a very concerning situation, because all these chronic diseases, if not managed well, can actually lead to complications which can be acute in nature, right? We also partnered with pharma companies on the oncology side, on immunology side, so that we could deliver care to the patients at home, whether those services were being provided earlier or not. So a lot has been done, but I think a big point which we need to take care of, all these chronic patients are not coming in the system as of now, which at the rate they should be coming.
Mr. Banerjee, what about your company? What was your experience in the lockdown period and now that the lockdown is open? Were there any, we anecdotally heard, not that I can confirm this, that at least some like the hydrochloroquine, those medicines were being quoted, they were unavailable, there were price hikes, some black marketing happening. What did you experience in the lockdown period, and what did your patients or those who took your medicine who had chronic conditions, what were their experiences like? Did they relate to?
Right. Thank you, Anisha, first of all, for giving us the opportunity to participate in this wonderful program of Gratitude Week, because this is a effort. I can't agree more than what all the panel members and the past panel members also spoke about, that the doctors, the nurses, the paramedics, the pharmacists, and all the stakeholder who is touching upon the patients and the caregivers, all of them are doing a fantastic job, and definitely they require a standing ovation from the core of our heart. Second is, you are also doing a fantastic job by bringing together all the experts and encouraging, motivating all stakeholders, including from doctors to government officials to pharma industry to patients. Everybody you are trying to bring together such that people can be motivated and try to find out the newer ways and adapt the new conditions to work and continue to do better. As far as our company and organizations and our working styles are concerned, we have prioritized, and we believe in two things, and we prioritize that. First is the safety and security of each and every employee of the organization, each and every stakeholders. And second is that the medicines, the access should be continued. So these are the two important things that we have taken it up. We ensured that our people should be accessible to all the doctors and pharmacists, hospital management, purchases, etc., such that the medicines should be made available all the time in sufficient quantities. We have also, we deal with mostly, in my business, we deal with cold chain products. And cold chain is a very big problem because, as Jortin also mentioned, that the air couriers have stopped. So that was a big challenge in the first billing. that happened that to make the product available by March end, the stocks were there at the various locations across the country. But then the next step, when it got extended 21 days, 30 days, like that, it continued till May. So mid of April, there was a big challenge. And then we, along with the logistic team, worked out how we can make these products available without compromising on the quality to all parts of the country. And then we have ensured that this product by 18th of the April, it was almost available all across the countries, from Cochin to Guwahati, from Jammu to Rajkot, all the places across the country. These products were made available. We ensured that the cold box with the refrigerations took the transport route, and then 5 days, 4 days, 3 days, 6 days, whatever it is required, we ensured the cold chain is maintained and all the products were made available. That's a big service because these products are life-saving products, and if it is not accessible to the patients, they are not able to get these medicines. We also developed a toll-free call center number so that patients who require these medicines from any parts can reach out to us in the central number. And then we tried to work out the logistics to make the product available. So this is a big satisfaction when we saw that all the products are available and all the patients are served across the country. And that is what one thing that we did. And when the second piece started, the unlocking the practices and unlocking situations, we are trying to do a lot of training and educational sessions with the doctors and the caregivers, such that they should keep how they should keep their clinics sanitized, safe, and overall they maintain the quality such that the patient should gain the confidence to come back to the clinic. But this is a job at hand. This is still in work in progress, and it requires some more time to gain that confidence. As Vivek was also mentioning, that in spite of unlocking the conditions, the patients are yet not get confident to come to the clinic and see the doctors, especially the chronic ailments like that of kidney disease, cancer are the worst hit, because these patients are also vulnerable and sensitive and very, very delicate in terms of getting the infections, because these are mostly the immunocompromised patients.
Yes.
So that is overall thing that we are trying to do and work towards making the healthcare better in this pandemic situation.
Right. Mr. Bhatia, like Mr. Srivastava also pointed out, that the prescription rate has gone down in the lockdown, and even after the unlock, it hasn't gone back to its pre-COVID days. Now, during the lockdown, and when people were just battling with the certain spot on numbers, many surgeries were being postponed in hospitals to save the immunocompromised patients from contracting this deadly coronavirus infection. These surgeries may have been required for patients who had chronic conditions. So, as a pharmaceutical company, how did you respond to this decision of surgeons to put off these surgeries for some time, which were not, extremely critical at that point in time? What was the company's thought process to these delays?
I think very well said. Just now, Amitav also pointed out, saying that basically what is happening is when it comes to surgery, there are certain things which actually are lined up by a doctor, and he understands when is the requirement for this surgery to happen, depending upon the condition. If it is like which is very acute and needs to be treated immediately, there is no other option, then the doctor definitely goes forward and does that. But we have seen in this pandemic, most of the surgeries got postponed. The kind of proactiveness which was shown by the doctors, and they started speaking more to the patient, because initially when the patient is more worried that if I am not treated, what will happen to me? But when they get assurance, like doctor, I think the patients definitely makes it ease, and he prefers that whatever doctor is saying, he is there to support and help. And the surgery, if it is getting extended, it is the need of the hour, and to manage that need of the hour, doctor has suggested like this. So I think doctors have himself come forward. They have said that if this is not required, we will postpone it, and we will see as the situation eases, we would be able to manage through oral medication. This is again one of the area where we have been able to see a good positive outcome on that. Now coming the impact on it on the pharmaceutical company in terms of the business and other cases, I believe the chronic medication, one knows that definitely they have to continue and patient has to take it on regular basis. So there will be some impact on the acute medicines, which we understand that in the acute era where the injectable sales and other sales are likely to go down, because when the surgeries are not getting performed, the patients are not coming to hospital, they're more worried about how their health, present health can be taken forward. Because now when you have in a house 4 to 5 member, and if one person gets affected, he may bring the disease to 4, 5. So all these precautionary things are being taken, and people awareness to this and their understanding, I think, has played a very vital role. The doctors have really played a very, very important role. They have given good time to the patient, make them understand the importance and relevance. It has actually given a lot of easement, and that is, I think, is a very right step. And we must appreciate the doctors, and we must also acknowledge the patient's understanding to this. As far as selling of medicine is concerned, I know my colleague here would agree that it is not always the business which we have to really run forward. I think on the human being individual, we must really look at that medicines will definitely sell later on. Today the priority is something else, and we all should come together to that.
All right. Ms. Parwani, what was your experience like? You spoke about diabetes patients. You also spoke about how many of those who suffer from these chronic conditions are elderly. They already feel that they don't really have much time, and they feel that they're suffering because of these diseases. And suddenly the doctor says, why don't you wait a little more? Because you are at greater risk from a now and present danger that you don't realize. How to handle the anxiety of the patient?
Anisha, as I mentioned, that we have this helpline numbers in place where we connect, the telecounseling team connects with the doctors, with the patients, and consults them on the drug availability, the access details of the doctors, do's and don'ts in the COVID scenario for diabetic patient. See, what also has happened, Anisha, is that face-to-face meetings with doctors actually stopped overnight, followed by sudden closure of OPDs. It was kind of a panic situation for patients, particularly for chronic conditions. We've also seen there's a lot of mental illness cases like depression, anxiety, more so staying home, social distancing, nobody to talk to, actually made people feel alone. And these things, in fact, aggravated the conditions. So in a situation like this, our helpline actually made proactive calls to thousands of patients. As I mentioned earlier, we could consult them on the do's, don'ts, what precautions need to be taken, which doctor to access into, what drugs would be available at what counters. We also need to remember that, yes, we have to be thankful to the doctors who actually done a phenomenal job by reaching out to the patients, taking maximum care for them, speaking with them over phones. In fact, I think the doctors have become more more social platform savvy. They have been using various social media tools to reach out to patients and guide them in this chronic conditions.
Right. Mr. George, what was your experience when doctors have elected to postpone a surgery? Does it really impact your supply chain? Because you, as a company, have already calculated X number of surgeries happening. Suddenly, many of them are being postponed. Does it really impact your production metrics at all, or you just continue with whatever numbers you were doing pre-COVID? And what about things like exports? So a number of drug companies also export their products. Were they also impacted during this pandemic?
Yeah, see, first of all, you need to understand this chronic patient, they are already immunocompromised. So they also already are very much vulnerable to any of the viral infection if they are not get treated. So on that above, if you postpone their surgeries and treatment, it will really create little bit of mental problem, and that is what other the speakers also addressed. Looking specifically towards our company, what I found is the oral medications, because doctors, especially cancer also, there are a lot of oral medications available. The oral medication usage are really increased, and the injectables. So if you look at the hospital occupancy, especially in the period from April to May, you can see that it is significantly come down. There, it is come down to 30% occupancy, 50% occupancy, because the elective surgeries and immediate transplants, such treatments are being postponed. So which really created, there is a real hall in terms of hospitals is concerned, and also for the acute treatments. But the oral medications especially was having a lot of surge in sales. So that way we were able to manage the balance between acute as well as the chronic is concerned.
All right, Mr. Sinha, all hospitals came out with their own protocols on how patients with chronic diseases will be treated during this pandemic time, because some treatments can't wait. They have to be given to maintain the well-being of the patient. So in these settings, did the patients reach out to you for extra information, because you have to get tested for corona before you get for cancer patients who go in for the chemotherapy and things like that, and there was also a paucity of beds. So were patients concerned about getting their chemotherapy on time and other such issues?
Anisha, you are right. I remember the first month or the first 2 weeks when this whole lockdown started. The number of phone calls that as an organization we were getting, even our patient support program partners were getting, was huge, because nobody knew what is going to happen, right? And then and also the treating physicians were getting a lot of phone calls. Now, and this was such an issue because there was a lot of chaos, there was a lot of uncertainty. And one way is that you address these questions one by one. As an organization, we actually took two steps. One was a direct step, and second was more of a working with other partners. So what we realized that in this country, we have a lot of patient support groups and patient organizations who exist, right? Sometimes we don't recognize them, we don't acknowledge that yes, they also have a very solid presence in our country, and they often miss out the forums. But what happened that for last 3 months, I think the way they have come out, they have started their own forums. They have started convening meetings where they have started requesting their doctors to come. And the conversation which has started, I'll give you, and I have multiple examples. One example, if I quote, in Tata Hospital, Dr. Kumar, Prabhat, and the Lung Connect. Lung Connect is not a group. It's an informal group of a lot of patient groups in Bombay who work in Tata Hospital. They started doing a virtual meeting. They have been doing this meeting. I think I have attended almost 10 plus meetings every week, and the patients started joining from remote of West Bengal, Bihar, and I remember one old patient coming online and asking to the doctor. He said, "Doctor, मैंने आपका चेहरा देख लिया, मेरा 50% problem खत्म हो गया." It's that emotional touch, seeing your doctor. That makes such a big difference. And these patient organizations really stepped up. They have started organizing these meetings. And it was not a usual thing for them. They were not used to doing these virtual meetings. But today, if you see the number of effort that these organizations have started putting together, and the number of patients they are reaching out, and the caregivers and the family is phenomenal. So that is something that we and these things require a little kind of help from you, more of a guidance, bringing these people together, and they learn very fast. The second thing, what as an organization, what we started doing is, as Mrs. Parwani said, that is the connect with doctor and patient. So what we did that patients who were part of our patient support program, and as Novartis, we always believe that giving these beyond the pill solution to our people who are living with a condition. So we have also started giving a virtual connect, which is a kind of a recurring connect where all these people, their families, people who are living with condition, they come together and they speak to their doctor. You know, and believe me, that was something that they all appreciated, because first time they all were together and they were with their doctor in a small group, living with the same condition, going through the same phase. And that is something which we maybe yesterday was Guru Purnima, and I think COVID-19 has been the biggest guru for many of us. We have learned things, though they're in a bad way, but for example, this virtual platform, I think has started bringing people together. And this is something that we have started now, and we will continue it, whether COVID is there or not there. So I think a lot of platform and using it to give, as I said, beyond the medicine, beyond the pill solution and support to patients. These were the two things that as Novartis we are focusing, and we will continue focusing on.
Right. Mr. Srivastava, as Mr. Sinha said, that, virtual platform, even on a virtual platform, when the patient saw the doctor, he felt so relieved. He felt that, half the disease was gone. But it is becoming increasingly difficult to get, technician into a hospital should you require it in a chronic condition. And your company is giving them at-home service now, be it at-home service for corona patients or for chronic conditions. How are patients reacting to this now? Do they feel they're more comfortable at home? Do they feel less guilty about inconveniencing their family? Is it cost effective for them? Can you throw more light on some of these issues?
Sure. So I think the perception of people about home care has dramatically changed in this short period of time, right? Earlier, things which people, and this includes doctor as well, things which doctors and patients thought will not be possible at home is being done at home. So the everyone, in fact, who I know of, and we get calls on a regular basis saying, can this be done at home? And these could be, very varied things. Some of them which cannot be even, done at home are being called for. So I think the acceptance of people of doing variety of things at home has increased dramatically. I'll give you an example, and I'll comment on what Prabhat said. So we did a conference, or we were participating in a conference which was done by one of the pharma companies on oncology, and there 50% of the oncologists said they were open to doing getting procedures done at home, which is chemotherapies at home and so on. If you would have asked this question prior to COVID, this number would have been much lower. And once the doctor says, look, this is possible at home, it is very easy for the patient to accept the fact. Like Prabhat said that आपकी शक्ल देख ली ठीक हो गया, तो डॉक्टर ने अगर कुछ बोल दिया कि यार ये हो जाएगा घर पे, तो people accept it. And we have been doing, whether it is oncology, whether it is dialysis, home peritoneal dialysis, and so on. The acceptance of variety of services has increased dramatically. And to Prabhat's point, I think we have been partners to 3 of the 5 pharma companies here in variety of programs. And we have ourselves reached out to the patients and solved all their queries, questions which have come in. In fact, we did 18 webinars over the last 100 days where we have reached out. We've got top doctors in chronic specialties to talk to the patients, because like you said, patients want to talk to the doctor, to see the doctor, to ask a lot of questions. So, and each of those would have reached out to about 40,000-50,000 patients. And hence the new model which Prabhat is saying works very well. And we have seen that with these doctors coming in. So also, I think you touched about insurance. Insurance has become very, very particular about home care. And very recently, ICICI Lombard, HDFC, and few other insurance companies have started covering both COVID and non-COVID at home, right, in these circumstances, which again is a boost for the patients, because now they're not, if they use home care, it's not out of pocket. They can actually,
Okay.
get that done through the insurance channel.
So that's a big, big relief. Mr. Banerjee, um, the way things are progressing now, there's a lot of focus on hygiene, on, keeping things clean, washing hands. Just these things will perhaps reduce the other diseases that would happen, typhoid and some of the other, hygiene-related diseases. So does your company then prepare to, make available the other disease, other medicines that fight the other diseases? Is there any, micromanagement that happens at that level that you predict going forward a particular kind of medicine will not be required as much as it is required previously?
So, good questions. We have already developed, because initially there was a huge scarcity of sanitizers and other thing. It's a small thing, but we tried to make it in a very quick. That was not in our core business, but we have prepared sanitizers and tried to make it available to all the places again across the country, such that the sanitizations part of it, the hand sanitizers, we have made it and made it available in the best of the qualities that I can assure you. So that is what one thing quickly we have adopted. We have adopted many things, and recently we have also gone into for some of the COVID drug like remdesivir and other drug. Both the drugs we have got it. So we are going to get it in the market shortly, and of course these are also available through many other partners. As an industry, we are trying to work on it to get the newer molecules quickly. And as we have heard in the morning, some of the Bharat Serums and Serum Institute, etc., some people are working on the vaccines. So we have currently that is not our capability, or what you call it, not a core subject for us. But in the long run, we can work it out. But right now, I can't predict all these things, because whatever I can tell is whatever we are already doing. So these are the things that we are trying to do. Hand sanitizers and other drugs, whatever is relevant. But more than that, currently our pain is that, as the other speakers also spoke about, that the chronic other therapies, they are not getting to the treatment. They are not coming up to come for the treatment. They are having a lot of stress. They are having a lot of problem. In our business, the dialysis they are not able to get the dialysis on time because of the access problem. These are all the challenges with which we are very much concerned and trying to work it out how we can help the patients.
Where do you think there'll be a larger demand for what kind of medicines? Since Cipla does all kinds. You also have antiretrovirals. You would have regular antibiotics. So where do you think there'll be a greater demand for medicines? And for those who have chronic diseases, would you look to then recheck or increase the output of those medicines, say diabetes or kidney health?
Yeah, see, you know about Cipla's ethos. We are there for affordable and quality. So when there was an HIV as a issue, our promoter had done a one pill, $1 pricing, which has really reached access to millions of HIV patients. So in COVID also, our endeavor is there to provide whatever medicines at an affordable and good quality to the patient and reach there. So we are working on multiple projects. We have multiple functions, like we have a CHL division, which is having the sanitizers, which is reaching to thousands of patients. And in our business, where the pharma others is there, we are the one of the company which first launching remdesivir this week, and it will be one of the most affordable for the patients is concerned. It is at 1/10 price of US pricing. That's what we are doing for the patients is concerned. And we have a strategic partnership with multinational company like Roche to reach a lot of products in India for the future treatment of COVID is concerned. So our protocol and our portfolio is reached for treating COVID patients is concerned. However, for other patients, where that is where our topic, which is the chronic patients, I agree with everyone that they need a healing touch from the doctor. Teleconsultation, virtual consultations are created a lot of help. 30 to 40% of patients are able to manage, but they need to, because initial stages the OPDs were closed down and they were not able to reach. So we can see that we lost two Hollywood stars during this time, Irfan Khan and Rishi Kapoor. This we know from media, but there are maybe more and more cancer patients might have lost life because of this. So this is another side of COVID, where end stage renal disease patients, they don't have transplant facility. There are patients who are in diabetes, they might have a difficulties, cancer patients. So this is a difficult time. Beyond COVID fighting, we need to together. So especially this home care treatment, my message to anyone who is attending, any patient who is having a chronic illness, I think they should use the platform of virtual to reach out to their doctors. You have a diagnostic facility, you have a home care treatment. So no need to wait to reach a hospital, consult us quickly, so that early diagnosis is the key factor in a chronic disease. So that cancer, a lot of cancer is curable. A lot of diseases is curable, but you need to early diagnose. So that is what is the key factor which we need to reach out to millions of people in India.
Right. Mr. Bhatia, then how do you do this outreach about early diagnosis? I'm just scared to get into any laboratory, to any scanning center, because everybody with COVID is going to these centers. I don't want to get it. I already have a chronic condition. So is there also an outreach that companies are doing to impress upon the patients to first be proactive about their diagnosis and not wait too long, even though the conditions are not most conducive for you to get active treatment immediately?
I think, Anisha, good question. Basically, if you look at the way last many years these scenarios are changing, not to talk of COVID recently, before that also, if you look at those companies who are able to afford that they will be able to provide each of its employee a kind of annual health checkup. There were so many diseases, ailment, which were getting diagnosed, which individual was carrying with him or her, but was not able to show because sometimes the symptom of those appear very late. So these kind of things which was there in the pre-COVID area, I think this will become more pronounced. What will happen is that people will realize that they need to be very healthy. They would definitely be more hygienic in terms of their approach to the life, to the society. Rather, that will become one of the most important talking point. This is what we have seen. And if you look at the pharmaceutical company, they are also going to play a very, very vital role. There will be a lot of new avenues which will come forward. There may be startups which would ensure that if we are able to have a package which can provide these kind of services at home, so patient need not really come to the pathology or laboratories where there is a lot of number of people available at any given point of time. So there will be a lot of segregation which is happening, which we were not aware. As an individual, we never knew the kind of social distancing to be made. In fact, to the layman understanding, there were blocks which were made. The people have to stand here, they have to keep this kind of distance. So I think all this learning will come into play, and pharmaceutical companies are definitely going to play a very important role. Along with that, the diagnostic company also will have a very, very important role to play here. And I'm sure something of that kind will emerge soon, where we might get the package deal at home itself, so that the proactiveness of diagnosis can be done, because there will be a lot of portable instruments which are being made, which were not there earlier. So I have seen in my last 3 decades of experience, huge things are happening. And here about Shilpa, I would definitely like to say, as an organization, we are talking of so much of hygiene to be happening now. Now, I report to MD, Mr. Vishnukant, and he actually has a very good, clear ambition and clear plan that we should be definitely more into the hygienic areas, treatment option or prevention option in the hygienic areas or nutraceuticals areas, where the proactiveness will play an important role. The support system will come in a manner that not only the disease to be managed directly by the medicine, but there will be other things which will increase the immunity of a person, and he will not become patient and will be able to really carry forward his or her life in a very, very robust and disciplined manner. I think a lot of changes are going to happen, and we will all witness that together.
Right. Ms. Parwani, you spoke about diabetes, and you also said that, in smaller cities where, the transport system was impacted, the supply chain was impacted, there was a little shortage of drugs in the initial bit of the lockdown. Now, have these been sorted out in smaller areas? And what special arrangements are you taking to address this situation, especially for diabetes patients?
Yes, Anisha. Yes, there was, and to some extent, it's still there in smaller towns. In fact, our sales teams has been working tirelessly to overcome all these challenges. We tackled drug access to patients by multiple initiatives. The first initiative, as I mentioned earlier, was activating a special helpline number to ensure drug availability. The same was actually flashed across retailers, across doctors, patients by our sales team, and also through social platforms or digital initiatives. Secondly, we also had assigned designated local state-wise contacts, which we shared with 7,000 plus doctors who are members of RSSDI, which is nothing but Research Society for Study of Diabetes in India. We shared these also on the RSSDI website so that we could facilitate access to medicines for patients through doctors. Most importantly, I think it was the sales team members who went out of the way. We gave them essential service passes, mobility passes, so that they could actually physically go and supply medicines to the needy patients. So we got support from RSSDI because they flashed the contact details of our sales guys on their websites. To doctors, our sales guys connected with the patients, and the medications were physically made available to the patients.
Right. Mr. Banerjee, what has been the role of some of these online pharmacies in getting medicines across to patients? Do you work with some of these online pharmacies, and are you also thinking of perhaps having your own system of getting medicines delivered at home?
Very important thing. So currently we have tied up with many of the online pharmacies, and which was in a slower pace before the COVID era. After that, we ramped up. We have adopted and got arranged with, got connected with many of the, most of the, I will say, the online pharmacies, and our products are available there. And they have ensured that we also ensured that the supplies will be there, and they have ensured that they will keep the adequate product, and no patient should be deprived of any of the medicine that they require. So that came up very handy. Initially there were a lot of, before the pre-COVID era, there was a lot of question answer, the associations issue was there, but right now it is the way of life, and making the product delivery, one of the channel is definitely the online pharmacy, which is going very stronger. But we do not, internally we do not have land to have our own online pharmacy.
Okay. All right. All right. Mr. Srivastava, can you tell us how many people are going for, if you see the entire patient as an entire group, in your experience, how many patients are those who are going in for home services are the corona patients, and how many are those who are chronic ailment patients? Do you have any statistics with us? Because more and more people, we see home isolation, home treatment for corona. But for those who need active treatment, my friend's mother has to go for dialysis. She has to take her to the hospital every 2 days. I mean, every other day, twice a week she has to go. So do you have any numbers to tell us, like how many people are going for home service? Is it primarily for corona and COVID care, or are they going in for the chronic care treatment as well?
It's a mix of both, actually. So on our retail business side, when the lockdown started, it was largely patients who were non-corona, who were coming to us because the hospitals were continuously emptying people out, and people were also wanting to come out of the hospitals as soon as possible. And then hospital occupancies dropped down significantly, which means when the non-corona patients stopped coming in, the patients' home care requirements also moved from from non-corona to corona, because hospitals also got flooded with corona patients. So as of today, on the retail business side, a large portion of our patients are coming from the corona side as well, whether it is home isolation packages, whether it is actually needing support at home. But we still have our patients who were on with us pre-corona time as well, if their diseases continue. On the work which we do with pharma companies, these are all chronic patients. So we touch about 1.25 lakh lives a month, and all these are chronic patients, and they are they could have corona, but they are interacting with us more on their chronic diseases, and not for the corona specific diseases.
And Mr. Srivastava, which all cities are you present in? I mean, how do you tie up your backends of medicines, of equipment? Are you present only in the metro cities or in smaller cities as well?
No, so I think so for delivery of products, you were asking Amitav a question on product delivery. So for delivery of products, we work with we deliver in about 600 plus locations across the country, which means drugs delivery. For when we work with pharma companies, we work in 70 plus cities and towns across the country. And a lot of things which we do are also done through the phone or through online mechanism now. And on the home isolation packages, etc., we are present all over the country, because these are more digitally enabled solutions, so you can treat any patient anywhere. For our own services where someone has to physically go in the home, whether it is for pathology checks, which Sundeip was talking about, or for treatment, whichever type of treatment, ICU setups or step down care, physiotherapy, or any other chronic diseases, we are present in major metros, and then there are certain areas around the metros which we are present in. So we are present in Punjab, for example. We are present in Delhi NCR. We are present in Bombay and the greater Bombay area, Bangalore, Kolkata, and we do deliver services in the nearby locations as well.
All right. Mr. George, for Cipla, going ahead, what are the four disease areas that you're going to be focusing on? One, of course, is remdesivir, which we are going to use for corona treatment. But for chronic patients, what will be the focus area for your company?
Yeah, so today, if you look at the evidence is coming, so we are DCGI and Government of India and ICMR is very careful in terms of looking at the evidence generation. So we are tied up with the DCGI, and we are doing evidence for Indian patients for remdesivir, and it will be very regulated usage in India. So we need to also know these are all early stages for patients. So we are working with multiple. We are doing another study with the tocilizumab with to see in Indian patient how it is working, which is a strategic partnership with Roche and Cipla doing. We are also planning to come with the favipiravir, if possible, to generate evidence and coming up. So there are multiple platforms, and it is very, very important. We need to look at other factors also. If you look at a country like Germany, there is an 8 crore population in Germany, and they are done 3 crore population, the test for COVID, and they have around 2 lakh patients positive. So that is the reported case there. So we are far away if you look at our population is concerned. So there is a lot more to do in terms of testing is concerned. And really we have to appreciate the government efforts, especially in terms of medication and testing. Now we are doing 2 lakh tests, and I hear from ICMR and the media articles that they are going to increase that to 1 million tests. So if the day which we hit 1 million tests, you will to see more positive, but nothing to worry in that, because it's because of the tests are going up. The tests are going up, you will see most positive, but the important thing in India is our mortality is much, much lower than the reported mortality is much, much lower than what reported in globally. So that is a joint venture of government, healthcare system, the fighters. That is why this entire session is very good, because with such a population density country, we are all fighting together and managing this. Is an amazing work done by everyone who is fighting against it. And I am sure India will come out of it. It's a matter of time. We will have a vaccination and the herd immunity will come. So once the herd immunity is there, more than 50-60% of population is having immunity either by a vaccination or they got the COVID and they got immunity. Then we will be able to see the slowing down of this. So I think we are all confident. We need to fight, but the safe distance, self-isolation and testing is very key for the census.
Right. Mr. Sinha, for oncology products, do you think they can be such that, you said there were oral dosages for cancer as well. Can these be delivered at home? Can you move more towards that kind of treatment? Because, for radiation, you have to go to a hospital. So for oncology treatment, what would be the way forward from a patient perspective?
Very good question, Anisha. If you see the way cancer is being treated, in last 2 decades, we have come a long way. There were cancers who was, the lifespan used to be 2 months. Now it has become a kind of, cancer is slowly becoming a chronic condition. Like when I talk about, let's say, CML, chronic myeloid leukemia, from a life-threatening disease, this has become like a chronic disease. So, at one end, we have been bringing a kind of the treatment to make it a kind of a chronic treatment. And now people have started talking about cure from cancer. Now, what you talked about, while there are various treatment options that are available in the country, we still have some of the existing way of treating. For example, let's say when we talk about treating patient with chemotherapy, right? Now we have seen there was an article like the drop in the number of patients who are coming to, let's say, Tata Hospital in Bombay. The number of patients coming to these hospitals, and in India, if you see majority of and especially when I talk about cancer, the cancer care is highly centralized. You have 6 or 7 cities where you have 70 to 80% of the experts who are there, whereas your patients who are in the rest 70% or 80% of the cities. So there is a big imbalance of where the care is needed and where care exists today. Now, when the treatment is, let's say, all treatment which requires hospitalization, what happens that sometimes patients have to travel, and now that is what is happening is patients are unable to travel to these care. Now, if I talk about some of the state government, they have started decentralizing cancer care, right? They have started taking cancer care closer to their towns. Even the targeted therapy, somebody talked, one of the panel members. Now there are a lot of targeted therapy which are available. When we think from the reimbursement, from the provider point of view, sometimes we calculate the cost of one drug, one vial, but there are a lot of indirect costs that is there. A patient has to travel, let's say, from a remote part to come to a center to get care. So it is not only that cost of that drug, there are a lot of indirect costs that is there. Now, in majority of our program, let's say if I talk about, let's say, Ayushman Bharat, which is the flagship program. Now, how many targeted therapies are part of the treatment package? It's a journey that as a country we are on. But I think the condition like COVID-19 has also given us a chance to rethink. What you raised is to see when we come about the treatment options, treatment packages, wherever possible, for right patient, right drug has to be there. We don't hesitate giving some of the advanced therapies, some of the targeted therapies, because as you rightly said, and Vivek was also alluding, that a lot of treatment actually can be given at home. And many of these patients can avoid going to hospital. And this COVID-19 is not going to leave us very soon, the way things are going on. And each day is a heavy day for patients, right? You also talked about diagnosis, but also there is also a chance of patients progressing on the disease. somebody who is not getting treatment will progress. And then as a healthcare system, we will be under tremendous pressure to again bring that patient back to the same condition. So it's very important to explore and identify what are those options where we can use targeted therapies, reduce hospitalization episodes. Insurance, for example, Vivek talked about. In our country, if you are not hospitalized, you are not supposed to get insurance. Now, for a disease where you have a targeted therapy available, the time you get that targeted therapy, you will not get reimbursement. Then what option you have? You have an option is to get hospitalized and continue getting something which is getting reimbursed. So I think this is, one of the very, very valid question what you raised, and I think we don't have an answer as of now, but going forward, I think, and that is where I also say that, when we talk about the need, right, and need of chronic patient, we all who are sitting here and talking about is talking from a perspective from a healthcare organization. Sometimes the actual need also comes from people who are living with that condition. And more engagement, more and more voice from these people on policy dialogue, on a discussion table. I think that is something which we need to put focus on. And in this forum yesterday, I was seeing that Dr. Narayan was leading a discussion where I saw some of the patient advocates from Indian Cancer Society speaking about. And I think, we need more such voice coming forward and discuss about these issues, that, how the life is going to continue, how, what is their perspective, what is the need, which is very important.
Right. Ms. Parwani, while for diabetes, getting your insulin shots, etc., is very important. Does your company also increase awareness for patients about lifestyle choices and better lifestyle choices that can help them manage their condition better?
Anisha, I think the coronavirus outbreak has actually led to a renewed focus on staying fit and healthy. Right? People are warming up to the idea of building immunity so as to avoid catching any kind of infection. In fact, Google India reports a 5,000 surge on searches for health products with a focus more on building immunity and more focus of increasing in vitamin C product searches. Actually, consumers across all social segments, more so chronic patients, have become aware about immunity, and they are actually desiring for products which would not add to the cost burden. So in such a case, what is the option that is available to them? It's vitamin C preparation, which is known for immunity booster, and consumers are actually taking it. We as an organization, we are going out of our way to help. See, if you see today, the offerings that we have, vitamin C preparation, it is just a 1 rupee 50 paise cost per day, which is hardly anything when we look at the overall cost of medication for a chronic patient. So as an organization, at many places, we have done free camps where we have given vitamin C samples free to the patients. In fact, one of the approaches which our sales guys have also done is we've given vitamin C supplements free to the healthcare practitioners, because we know that they are in and out trying to see patients. So I think we as an organization are not primarily present in the core therapy areas tackling COVID, but in terms of supplementation, in terms of immunity enhancement, we have gone out of our way to help patients. Most importantly, there are a lot of challenges today with the China restrictions. Vitamin C dependency is huge on China, but still making the product available at a 1 rupee 50 paise per cost. I think our company has gone out of the way to help the Indian doctors and the patients.
Right. Mr. George, wanted to talk to you about, what the situation is like for the pharma industry as such. Now, Ms. Parwani spoke about the API situation. The government is encouraging more companies to, create APIs within the country. Plus, there's also a worry about jobs, and a lot of people are saying that this is a golden period for the pharmaceutical industry because everybody's going to be focused on health. So, in this golden period, are there going to be more job opportunities in the pharma sector? Can you touch upon how the pharmaceuticals industry is becoming self-sufficient and the opportunities it's going to create in the near future?
Yeah, it's a very important question. Still, we have a 60 to 70% dependency outside India, especially China and other countries for our APIs. But I think we should appreciate, the initiative of government. There are a lot of incentives governments are announced in last 1 year, so that a lot of scaling up of this thing is happening, and you will see in next near future our dependency will come down, so that we will have self-sufficient APIs will be there. So that work is happening by entire industry and with the help of government. Secondly, looking at the jobs, yes, it is going to be a challenge for everyone in the industry, not only in pharma across, but pharma is lucky compared to if you look at a social sector like tourism or a hotel industry or an airline industry is concerned. But what we are ensuring is we as a company, we are trying to protect all the jobs so that, nobody should lose anything. And then secondly, looking at, other, increments and other factors is concerned. So we are very cognizant, because these are also all pharma medical reps, all pharma employees are also various in this fight, because they are there to educate doctors, they are there to share knowledge, they are there to reach out to medical education. So we need to be part of it. So we have full commitment towards entire field force and the supply chain and the production. The production teams are working overnight. They are working three time shift, 4 time shifts. So we should not forget their contribution, because mass productions are happening in India for self-sufficient usage of medication. And you should imagine, look at the case study of remdesivir. In US, it is approved 1 month back, and the entire US stock is being purchased by US government. So there is no stocks available outside US for a patented country. India, we can be proud about Indian pharma industry, because we have 5 to 6 companies are coming out at 1/10 price and with a strategic partnership with Gilead. So that means Indian patients are having medicines available, which may not be available for hundreds of other countries. So these are the good work which our production team, our R&D is doing, our API team is doing. So that we need to contribute and attribute to their contributions, and we should applaud this.
Seriously, along with our doctors and nurses, we have to give to the pharmaceutical industry to also, come up so quickly with solutions to ever-changing conditions and, not leave customers high and dry. Mr. Bhatia, I want, like Mr. George was talking about, he gave an example of remdesivir. Now, India is not widely known as, it is known as the software center for the world, but it's also the pharma factory for the world. We supply drugs, the generic versions, to many countries, and we are very large generic players in big pharma markets like the US. So, what is your prediction of where the pharmaceutical industry is headed when it comes to ramping up production facilities, etc., for once that 1 or 2, it's not necessarily one vaccine, even more than one vaccine can come. So is the pharmaceutical industry in India geared up to get millions of doses out in short time?
Very rightly asked. If you look at the way I think scenario are changing, I'll just take you back to the history. A few years before, when government announced that we will have special pharma SEZ, and in a lot of cities, the pharma SEZs were open. You had SEZ opening up even in Hyderabad. It is opening up in Guwahati, also opening up in Karnataka. So these SEZs, which were not so prominent for pharma, are now opening up in a big way. And you see a lot of API players, they exist. A lot of companies which are operating as an API player in India, they have export. Like I will give you an example. Recently, when I have joined Shilpa, this is a company, I realized 33-year-old company and having an API, bulk drug, intermediates, formulation, and this is one of the world's leading supplier of onco and non-onco APIs. But the presence in India is now coming up. So I think there is an opportunity. There are companies which are present in India, like what Prabhat was talking about. There are companies which are present in India would definitely get more opportunities to have their own API manufactured and they may become one of the major suppliers outside India, because the dependency definitely on China will definitely get reduced. And who are the players who actually are known for affordability as well as quality? I think India has clearly made its mark that we are one of the country where not only affordability, quality, we will also have consistency of supply, which would be making for our APIs. I think API business is going to boom, and the opportunity for pharma people definitely is going to be there. I don't see, unlike many other industries, there will be any kind of shortages of employment or employment as a whole. It will definitely exist, and API is going to rule us in a big way, make our presence felt in the global scenario in a more robust manner. I'm sure we will be able to see a lot of upside here, and government will come forward, because the way last 1 year they have been able to support, there you will find a lot of cities will have pharma SEZ, and these will all be supported well by the government initiative in most of the states.
And what about the production capabilities to ramp up production of a particular kind of medicine? Should there be a global demand for it? Is the Indian pharma sector prepared for this?
Yes. So based on my experience, I can tell you, see, every company is looking forward to have an immediate solution in the form of vaccines. And every country is making its effort. And look at the way we have come forward. In fact, we have multiple Indian companies which are looking forward to have the vaccine in India soon. Surely there will be phase 2 trial, there will be phase 3 trials, and there will be many other things which will happen. But the companies which are coming forward, you will find multiple companies will have one solution, like the new antiviral has come. Lot of companies will have one antiviral. So there will not be any shortages. There will not be any supply demand gap. And in fact, one very important point which Prabhat was talking, the targeted therapy which is coming into force, which will avoid patients coming to the hospitals. And the targeted therapy is going to be really very, very economical in the sense that they would definitely not require hospitalization. The cost of treatment will go down. And there are so many targeted therapy which are coming, which will bring easement in the cancer treatment. In fact, recently, we also got an opportunity to introduce, especially kidney cell, and the drug is axitinib, which will be there in the market, and already we have come out with that. And you will see the kind of acceptability for targeted therapy will be there. It will be immense. So I feel very strongly about India and Indian companies that we would be able to face off these things very, very prominently, and we will have sufficient kind of work when it comes to production through our SEZ.
Right. Mr. Sinha, the question to you now is that, because of this pandemic, a lot of people are affected in many other ways other than health. Their incomes, their employability, all that is in question. So sometimes, the treatment cost of some of the oncology products are quite high. That is another reason why they feel hesitant to go in for, such treatment. What can be done here? How can they, first you need to be aware and get diagnosed early enough, then you need to take the treatment. But if the cost is something that worries you, what could there be a solution?
Yeah, I think this is the most important one of the question is about access. So when I say it's more than cost, it's access, and also how what are the hurdles. Now, if you see when I talk about cancer, for example, and also for disease like diabetes and all, in India, which has been primarily a self-paid segment, right? Almost 70% of us. For healthcare, we have to pay from our own pocket. 20 to 30% are, blessed to have insured, and whatever they need, the healthcare system is going to pay for that. Now, for last 2 years almost, when the way we have seen the one of the biggest health assurance program, which is Ayushman Bharat, has come up, I think it has given a lot of hope. And if today we see that almost 40% of our population, is getting enrolled as part of that program, and this program is for all those people who were primarily getting a lot of issues getting access, right? Now, and I think that is one of the biggest steps. And if you see the data of Ayushman Bharat in terms of, let's say, cancer patients utilizing Ayushman Bharat or Gold Card, it is phenomenal. And I think that has started reducing the burden from the patient, right? It also stopped, or kind of avoid delay that happens because of getting money to that. And as Mr. Bhatia was saying that currently, this we are on a journey, and Ayushman Bharat, yes, currently it covers a section of population, and disease like cancer, nobody is rich or poor. It breaks everyone, and the cost of treatment is high. Now, it is not only the 40% of that population, but we also have a very big, middle income population. And I think sometimes this is a section of population which often gets, left. If you're very poor, if you're BPL, you can get something. If you're ultra rich, you can get something. But being a middle class, it has its own challenges. And I think one biggest thing that needs to be taken care of is either, slowly we see this coverage from 40% going to, let's say, 60%. And what Vivek talked about is the insurance started addressing some of these cancer treatment, for example, what we talk about. Now, these two things is extremely critical. As the treatments are changing, the cost of treatment or the value that these treatment offers to patients, this is not going to come down drastically. The treatment, as somebody is saying, that the cost of treatment, let's say, is 1/10 of the price that we pay in US, but still it's a big cost for a person who is living with that condition in India. So we need to have a reimbursement mechanism. We need to have a good insurance system. We need to have more and more treatment packages part of the existing insurance or assurance program what we are having.
Right. Mr. Banerjee, in the end, I would like you to have the last word for all those who take the drugs from your company, from Cipla, from Shilpa. If they have a chronic condition, what's your advice to them? Going ahead, what can they expect? Mr. Banerjee, you're on mute.
Yeah. In general, for all the patients who are in chronic conditions currently, there is a bigger challenge. So we understand that their access to the clinics are a challenge, as well as getting the medicines. And our job is, being the pharma industry, we have to keep ourselves safe. At the same time, we must ensure that the drugs are available. We should partner with the doctors and ensure that their clinics are hygienic and safe, such that patients should get the confidence to come for the treatment and get the right treatment till we get some prophylaxis or vaccines and all these things, which may be around 9 months to 1.5 years, 1 year, whatever timelines that may come over the period of time. Till that time, we have to live with it. We have to understand, and we have to find out the ways and means. We have to adapt it. We are adaptable, we are agile as Indians, and we have done a fantastic job in the last 100 days roughly. And I believe that we will continue to find out better solutions which can help the overall community as a whole to do well, and the good health can prevail. That is what the last thing I would look forward from all the things. I would like to thank all of you and all the panels and the ISW for giving us the opportunity to represent. Thank you.
Thank you to all our esteemed panelists who have taken the time out to share with us their experiences and their advice to patients going through chronic conditions. Thank you, Mr. George. Thank you, Mr. Bhatia, Mr. Banerjee, Mr. Sinha, Ms. Parwani, and Mr. Srivastava. Thank you so much for taking the time out and coming for this session.